should go and seek medical attention ASAP.
Okay, so somebody has a headache. He has used maybe paracetamol for 2 days. That is enough reason to go to the hospital?
I think so, yes.
Okay, what if it's a headache that is secondary to lack of sleep?
Oh, so that's when...
Something simple, like sleep a little more and he's okay. He will feel so silly that he went to see a doctor just for the doctor to tell him sleep a little more.
Oh, yeah, you know, I agree. I know that's the reason why some people are very, they don't like to go to the hospital. But it's better to feel silly than to lose your life, okay? There are a lot of more serious causes of headache that we can get from a proper history. That's asking questions about your complaint and then a proper examination. There are people that have a headache now and by this evening they are gone. We've heard of a lot of even people, media personality that complained of a headache and they are gone in a few hours. Some of the most dangerous reasons why people can start with a headache and be gone can be something that they call, any bleed in the brain. Any bleed in the brain.
Okay, so here's a really pertinent question at this point in time.
Okay.
The injunction is to see your doctor if symptoms persist after 2 days of using painkillers. How does somebody know that the pain he's feeling is even more serious than that and 2 days will be too long?
Exactly. The thing is, if you get any severe headache that starts suddenly, run straight to the hospital.
Once you feel it is
any
severe
headache, one of the common ways of grading headache is 0 means no headache, 10 is the worst kind of headache you can imagine. If you get any serious, severe headache now, run straight to the hospital. Okay? If you start, and then there are some other headaches that, as you're having a headache, you are forgetting things.
Okay.
Once you start forgetting things, or you lose consciousness, you need medical attention.
Don't wait for 2 days.
Do not wait.
We'll take a short break now. When we come back, we continue. Please stay with us. Do not go away. It's getting interesting here. We'll be back in a minute. Welcome back. You're still watching Headache Disorders on Health Matters. You can call us at 0808-054-2233 for your questions on headache disorders. That is 0808-054-2233. And you can always tweet at CTV_Mary A. And now, you said that headaches are sometimes secondary to something else.
Yeah.
What are some of these things that headaches can be secondary to? First of all, that means that something is the matter. And because of that something that is the matter, there is now a headache. What are some of these conditions? Okay,
let's start with vascular conditions. If somebody has a stroke, or which is, if he has a stroke, if he bleeds in his brain, if he has what we call an aneurysm, an abnormal dilation of the blood vessels in the brain, they can have a headache. Those are potential dangerous reasons why you can have a headache. Infections. Infections of the covering of the brain, I think I mentioned that earlier, and that's what we call a meningitis. Infection of the brain substance itself, we call it encephalitis. Okay? Sometimes it's an infection of both, so we call it meningoencephalitis. Okay?
Those are terrible. But are they treatable?
They are treatable. A lot of them are treatable. And that's why early presentation is quite important.
Okay, so let's go back to the primary headaches.
Okay.
I've been told, I don't know if it is true, that headaches like migraines last a lifetime. Is that true? Does the person never stop having those migraines?
Well, it's not entirely true. There are a lot of people that have migraines, and after a while of treatment, they become free, headache free for a long time.
Isn't it frightening, having to wait, knowing that a headache is going to come, because it always comes, and not knowing when it's going to come. Does that happen to some people?
Okay, well, there are some people that, particularly with conditions like that cluster headache, they can almost tell the time by their headache. Okay?
Oh, it's regular.
It's when it comes in the clusters. Okay? They may have it once a year, once in 2 years, or once every few years. But during the few days to weeks that they have it, they can almost tell the time. Meaning,
okay, so if a person knows the cluster headache is coming on and it's going to come, isn't there a way the person can sort of prevent it?
Yes. So that's where we come in, okay? If you come and you see a person, a neurologist, and he gives you a diagnosis of a cluster headache, there are drugs we can give to abort the headache. There are drugs we can give to prevent the headache. And there are drugs, to prevent it during the time that is expected to come.
So this person can actually live, let me say, a cluster headache-free life.
Yes,